We're here with one of the leaders in the mental health advocacy movement. He is Phil Lubitz. He is the Associate Director and Director of Advocacy for an organization called NAMI, New Jersey. NAMI stands for?
That's the National Alliance on Mental Illness, Steve.
What do you do?
Well, NAMI was an organization that was started by family members back in 1979 to advocate for better treatment care for persons with a serious mental illness.
Explain to folks, Phil, so many of the people we're talking to here at this conference, put together by our colleagues at Perform Care, are saying that you can't treat mental illness just by treating the patient. You have to treat the family. But what does that really mean from a practical point of view?
Well, I think we've learned that we're dealing with more than just symptomology. There's a whole person we're talking about. So his environment, his living situation, his social environment, the supports they have. Those are all elements that are important in an individual's recovery.
Give us an example from a practical, less from a clinical point of view, but more from a practical point of view, so people who are trying to educate on public television better understand exactly what you mean.
Well, I think of your own life. And, we really don't act as isolated individuals. We count on friends and families for support. When we have a problem, we go to them. We need a sense of place. We live in a community. And people with mental illness are really no different. They need a sense of community. They need a sense of purpose in their life. They need a sense of belonging in their life. And I think that's what we talk about when we say we have to treat the person, the family, and really create a whole community around people.
And finally, Phil, the expression being used today is celebrating the past, right? The last 50 years since 1963 when this Community Mental Health Act was signed, but creating our future. What is the future we're looking to create for those who are struggling with mental health issues?
Well, I think it's just that. We really have to think of more than just symptomology. We have to think of the whole person living in a society. We have to really promote the idea that people are recovering and will continue to recover as we move forward into the future.
And that law was landmark legislation, critically important. It changed everything, didn't it?
For more than a century, people were locked away in isolation in institutions that had really grown to be enormous institutions, so that people are able right now, instead of being institutionalized, to take part in life, to really
be in the community.
In the community, that's right. And really to have all the rewards of living in the community again, to have a family, to have a job, to have a purpose for their being.